And they've been very, excuse me. That's a STEMI, so we gotta go. Sorry, guys. When that 911 calls, okay, now what happens?
There is a full appreciation that this is a potentially life-saving intervention.
I mean, there's all kinds of complications that you can have if you have a heart attack that's not treated appropriately.
Our community is supported by very proficient and professional EMS crews that arrive on the scene. They begin to assess the patient immediately, blood pressure, heart rate, O2 saturations.
Deep breath in and out.
We're having our ambulance crews do EKGs in the field, and they're interpreting the EKG, calling the emergency room doc, and the ED doc will make the decision to initiate the team.
Requesting entry note for a STEMI patient going to Beverly Hospital.
STEMI stands for ST segment elevation MI, and that's a specific type of heart attack.
All right, so what do we have, guys? Called us this morning, say he's having crushing chest pain.
Now the Beverly Hospital has the ability to perform an emergency angioplasty. There's no longer any delays involved with delayed recognition in the emergency room or transfer to another hospital. We can actually bring urban level care right to the community, the patient's own neighborhood.
Cath labs en route.
Well, when you have a heart attack, it's very important that we open up that artery as soon as possible, because as that artery is closed off and the blood supply is choked off to that area, the heart tissue begins to die. The longer that the artery is not supplying blood flow to that muscle, the more tissue that dies.
That's where the emphasis comes to door-to-balloon time, which simply is the time it takes for someone to hit the emergency room door and to go to the cath lab and get a blood vessel open.
Our benchmark is 90 minutes. We're averaging around 60 minutes, some even less than that. So I'm very proud of our team to get those kind of numbers. Our outcomes have been very good. We've been taking care of very sick patients, and they've been discharged from the hospital. We've had some very good outcomes. I'm very pleased with that.
Implementing primary angioplasty was a 5-year journey, and it really demonstrates who we are as an organization. We have clinical advancements in so many other areas, and this particular service was missing.
Left core, right core, angled.
We needed to establish a program here at Beverly Hospital, in particular for the Cape Ann region and our primary service area.
Yes, Paige is just doing STEMI, she's not doing
I've been working on this program for 3 years, and there were a lot of hurdles to jump through, and there were a lot of barriers here. But one of the catalysts to really getting this program off the ground was the arrival of Dr. Lockery.
This is one of our heart attack patients.
He truly is an educator. He works elbow to elbow with our nursing staff to make sure that the teamwork that is necessary for these types of programs is in place. He works very collaboratively with our other physicians, and he really has an approach that means excellence.
In the lab, we want to make sure that if you listen to lectures across the country about successful cardiovascular programs, they always come down to it's a multidisciplinary approach.
In fact, in recognition of that, Beverly Hospital has created a cardiovascular department which has representation from vascular surgeons, radiologists, cardiologists, and we all sort of work together.
The EKG was at 3:47 a.m. There are so many different parts to this puzzle.
Talked about this in the suite just
But
now.
everybody's chipping in. What I like to say is, this is not one person's program, it's our program. It truly is our program. And that's evidenced by the fact of the successes there because of everybody's involvement.
You gotta be careful creating two different processes.
In the state of Massachusetts, you start with emergency angioplasty. If our volume and our numbers look good, at some point we'll get to move to elective angioplasty, which really broadens our scope of practice.
It goes through your body, goes right into the heart blood vessel.
The benefit of offering more than just cardiac catheterization allows us to have patients come to our facility and be taken care of. And because we hang on to those patients and they know they can get good care here, they're more confident in us, that elevates our cardiology division. Then what happens is that patient stays in the system, the other services are required to take care of that patient, and the whole hospital benefits. So This STEMI program is a nidus, if you will, or a template to build the division, to build the hospital, and recognize that we can come to Beverly and have good cardiovascular care. That's our goal, and that's our main focus.